This is Rogers TV. The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
Securing your recycling in a few steps is simple, like bundling your cardboard separately. These bundles can act as a lid for your blue box or placing heavier items such as magazines on top of papers with no material above the rim.
Hello and welcome to another edition of Talk Politics. I'm Deborah Hutchison in the Rogers TV studio. Our guest today is MPP for Pickering, Uxbridge, and the President of the Ontario Treasury Board, Peter Bethlenfalvy. Thanks so much for joining us via video. You are safe and social distancing in your constituency office, it looks like.
I'm actually at Queen's Park and practicing physically distancing all the time, and it's good to be with you again and in this time.
I have to ask you, making headlines, of course, daily, is the tragic situation at Orchard Villa. The number of deaths continue to rise. The number of staff infected continue to rise, even though we've brought in Lakeridge Health and the military. Is there any end in sight for these poor people?
Well, first off, I want to say, my heart breaks. It's a devastating experience to go through, and I've talked to a lot of the families, and it's really a painful time for everybody. I think in terms of is there more to come? I mean, I hope not. I think the actions taken by the Lakeridge Health and their professionals and the military, I mean, it's all hands on deck. And so, we have to all just do everything we can do to support the residents, the families, the workers there, to do everything that we can, not just in that home. Of course, Orchard Villa really touches our community. It's been devastating, but to other homes in the region and in my riding, and in Durham and across Ontario.
The Premier himself has said, that the system clearly is broken and that COVID-19 is just highlighting how broken it really was. Going forward, what is the government committing to? Well,
he's been very clear, and I think all people would agree that the system is broken and we've got to fix it. The Minister of Long-Term Care this morning highlighted that we will do a review. She's committed to do a full review. The shape and scope of that review is to be determined. So we'll get to the bottom of this. And the Premier and I share the Premier's view that we'll get to the bottom of this and we're going to fix it. Right now, we have a clear and present situation, making sure we do everything we can to help the residents in not just long-term care homes and retirement homes and congregate settings, to do everything that we can, everything that it takes. In some cases, bringing in the military, in some cases, bringing in hospitals, making sure they have the PPE, making sure that they have sufficient staffing, making sure that the infection prevention and control teams are in there. Because this is an unprecedented situation we're in, and it's really all hands on deck.
Now, the Ontario Health Coalition, we're taping this May 7th. Today, the Ontario Health Coalition revealed a new analysis of the number of the death rates in our long-term care homes. And they say we have had more deaths in for-profit long-term care homes than in non-profit and municipally owned homes. Do you see the government moving in to have more controls over for-profit long-term care homes?
Well, I think this review will have to look at all aspects and figure out what steps should be taken. I think everything's on the table. I mean, clearly, and we'll have to get the facts and the evidence and across the province. And I would add that this is, as painful it is, our world is right there in Pickering and Orchard Villa. That's very close to my constituency office. That is our world right now. But this is going on in other parts of the province, and it's going on across the country. So we're going to have to take a look at all aspects of this. One thing that I find, we're all in this together, and I've reached out. A number of families have reached out to me. Some who've lost loved ones at these facilities, and I can tell you that a number of them said, Peter, we want to help. We've learned a lot of things through this, and we have ideas on how to fix it. And isn't that an amazing thing? You're dealing with loss, and you're thinking about how to fix it for other people. So I think we're gonna have to do this together, multifaceted. Everything's got to be on the table, and that we've got to take a hard look so that we don't go through it again.
Some families that we have spoken to have residents not in Orchard Villa, but in some other long-term care homes. And with all of this going on, they're grappling with, do I pull my parent out of a long-term care facility at the risk of losing a spot? What do they risk if they pull their mom or dad out of a facility?
I can't comment. I don't know the specific situation, but I think trying to do everything you can to protect a loved one. Everyone should do what they think they should do, and whatever the protocols and the regulations are, I can totally understand that. I've been touched by many families who've reached out, and there's many situations. I will tell you, my constituency staff has been working around the clock. I mean, 24/7, 7 days a week to help those families. If there's someone who wants to get someone out, and that may be the public health is the place to go, or maybe Lake Ridge Health if the hospital's in there, or to the operator. Any situation, reach out to my constituency office if there's some way we can help.
I think what they're saying to us is they're afraid of losing that spot and going to the bottom then of the waiting list because they're hearing different stories.
Yeah, it doesn't make sense to me. I don't know how you should lose your spot because you're trying to do everything to help your parent, your loved one. But again, I don't know all the rules, and I certainly would support them not losing their spot.
Now, you have taken part in several, drive-by convoys of thanks. What kind of an emotional experience is that?
Well, that's a great question, and thank you for bringing that up. I did the Ajax Pickering Hospital drive-by, and at the time, with the motorcade, you've got the fire trucks, etc. It's really a moving, and people on the side of the road waving. And then when you get to the hospital, I'm waving, and just like everyone else saying, thank you, frontline worker, thank you for your service to helping those who have need. And they're waving back, and they're smiling, and they're saying thank you to us driving by. Very emotional. I choked up. I'm choking up right now. You realize that you're all in this together. That we are one, and we all are going to do something. We did a drive-by at Orchard Villa, and I waved at a lot of the people. They were waving. Residents were waving out their windows. It's impossible not to be touched by that. And there was one last night for Bay Ridges that I participated in, and again I caught myself choking up.
The government has announced that it's stepping up the testing levels, but the Premier himself the other day was calling out a few health departments for not keeping up with its numbers in regards to testing.
Well, I think he's shown tremendous leadership in this regard, and we have great medical officers across the province. But there's no question in my mind, in his mind, that we have to test more and more. That's the only way you can be certain. And now we're testing everybody in a long-term care facility, testing everybody in a retirement home, testing what they call asymptomatic people who don't have the symptoms yet. Because without that, you don't know who's got it, who's spreading it. And that's the only way we're going to flatten the curve. So in terms of testing, I would say that that is a absolute requirement. We'll continue to push the testing of Ontarians. We lead the country, I believe, now in testing per capita, but we have a lot more to do there. And as businesses recover and start re-entering the economy, we've got to be able to test. One of the conditions for that, and I'm sure we'll get into that, is our ability to test where there are outbreaks. So that's a core part of going forward with this in this environment.
Now, you yourself, in the early days of this, you thought you had COVID, and you were tested yourself.
Yeah, what an experience! I'd been at a mining conference where there were a number of people got infected, and then I was in Ottawa twice with large groups and congregate settings, and came down with what felt like the symptoms. Mm-hmm. Really was on my butt for a while, and put the phone call in to my doctor. Got called by a nurse who does the assessment. I went through that. In this particular case, the woman said, you better go to an assessment center. So I put on my Darth Vader mask, lined up with everybody else, and it was quite an operation. And then they did an assessment at the assessment center and stuck the swab up my nose. Which
I'm told that's painful.
It is painful. I'm still cringing when I said that. Unfortunately, I did not have COVID-19. It came back negative, although I can tell you it was a very stressful time because apart from not knowing if you have it or not, I had been in social settings with my mother and others. So before that it came out. So, and she's obviously a little bit older than me. So you really worry about these things, but got through it. And I saw our healthcare system in action. We have an incredible group of people. That's why I get choked up, driving by Bay Ridges last night, all the personal support workers, the nurses, the physicians, the people who feed everybody, the people who clean. There's a whole range of people that really are doing incredible work. So I got to see it firsthand.
Okay, I'm going to stop you there. We are in conversation with Pickering Uxbridge MPP Peter Bethlenfalvy. Stay with us. More to come after the break.
Securing your recycling in a few steps is simple, like crushing your cans and bottles down in your container's blue box and your box board down in your papers box. This saves a lot of space and reduces the possibility of material blowing out of your blue box on windy days.
Do you have something to share? Let everyone know about your next meeting, your need for volunteers, or your fundraising event on the Rogers TV Community Billboard. Send us your words and we'll bring them to life on Rogers TV and rogerstv.com. When it's time to spread the word, go to rogerstv.com to add your announcement to the Community Billboard.
Welcome back to Talk Politics. Our guest this week via video is Pickering Uxbridge MPP Peter Bethlenfalvy, who was also president of the Treasury Board of Ontario. And we thank you so much for taking the time to join us today. Let's talk about that economy and money and restarting the economy. You were on the Ontario Job and Recovery Committee. A lot has been made about how devastated our economy has been thanks to COVID-19. Will we ever return to the level we were at prior?
Oh, I absolutely believe we will, and I think we're going to exceed it. How quickly that's going to happen is anybody's guess. I mean, there's so much uncertainty right now, but we've seen through this the incredible innovation of the Ontario economy. For example, I toured a facility that's retooled recently to do face shields. There's companies retooling to do swabs, which is part of the testing process that we talked about earlier. We're talking to companies who are retooling to build ventilators. So the ingenuity of the Ontario manufacturing sector is just incredible to see. And I think that we will get through this. We'll get through it together, and I think we'll come out stronger on the other side. It's just going to take some complicated work to restart this economy.
When you consider all that the province and I guess the federal government too, of course, all the extra money they have had to find for relief efforts and for supplies, in the end, how are we going to recoup that, and how is the government going to get that money back?
Well, that's something we've definitely have to consider and keep our eye on. But our focus hasn't been. We have a significant borrowing capacity. I'll remind everyone that interest rates are very low, and I am confident that the economy will come back. So those are things for to obviously keep our eye on. But right now, the clear and present situation that we have to deal with is, first of all, do everything we can to save lives. I mean, that's our number one priority and will continue to be our number one priority. And who knows what's around the corner. Knock on wood that the 14.5 million people in this province have been practicing physical distancing and self-isolating, and they've really stepped up, which is incredible to see. It just reminds you how great this province is day in, day out when you see people making huge sacrifices. I think that, but a big focus of ours will be on how we restart this economy as well, and so that we can certainly down the road have the economy to repay some of the money that we're borrowing now. But I'm president of the Treasury Board, as you mentioned at the outset. I write the checks in the province, and these are some of the most important checks that we're writing today to put programs in place to help people. Obviously, on the healthcare side, we've partnered with the federal government, and a real shout out to the federal government and our partners there. I talk to my counterpart all the time. We're really working together to put in supports for people who are suffering in this environment, be they the wage subsidy, be it with regard to rents, with regard to even what we call pandemic pay for our frontline workers. So there'll be a time to look at that, but right now we've got to deal with the current situation.
Is there a level of cooperation between levels of government that there wasn't previous to COVID-19?
Well, I think there'd always been a level of cooperation. I think even before this, you saw Premier Ford play a leadership role in the Premier's Council and with the First Ministers and the federal Prime Minister. So that the groundwork had already been laid there, but it's just accelerated through this pandemic. And it's really all hands on deck. And I'm struck by the collaboration among premiers, collaboration with ourselves and the federal government at all levels. All our ministers are talking to their counterparts in Ottawa, and also municipally and the regional government. A real shout out to the people in Durham. Certainly Pickering and Uxbridge mayors and council have been terrific to work with. The regional chair for Durham, and we're all in this together. So the groundwork was always there, but you really learn in times of crisis how good the people are that we have to work with.
Even those that perhaps were very critical of the Premier prior to COVID-19 are admitting that he is showing great leadership. How does that make you feel?
Well, it makes me feel great because, he's a guy who is just like all of us. He cares deeply about this province. He cares deeply about the people. Now, I get to see the guy every day just about, and I sit beside him in cabinet, and, what you see is what you get. The guy who wears his heart on his sleeve, really takes a lot of this personally and is willing to listen. And is showing real leadership in terms of talking straight to the people of Ontario. Sometimes the message isn't easy to swallow in terms of what's happening, but he's very forthright, and he's like that day in, day out. So I'm very proud to work with him, and I'm not surprised that the people of Ontario get to see what I see day in, day out.
Let's talk about, as we tape this May 7th, yesterday it was announced that the province is further easing restrictions on some retail stores, but we're going to do it very carefully.
Yeah, so we have announced, a bunch of announcements that was started last week. And we're going to be, we have set out a framework how we're reopening the economy. A lot of it's based on science and evidence. So the amount of testing we can do, the tracing, the PPE, the physical distancing. We've put out regulations. Been very clear. I think we did that about a week ago, saying here's the things that you have to do once we say it's okay to open. I think it's 65 sectors, and you can get that on our website, on our Ontario.ca website to find out what those guidelines are. We've clearly announced as well that for garden centers and for hardware, you can open, I think, starting tomorrow night, and then, tonight, 12:01, and then Friday night, 12:01, to have garden centers and hardware stores kind of open, and service centers open the same way a grocery store operates. And we've also allowed retail operations to provide curbside service. So that's all sequentially allowing where the evidence is that they can practice physical distancing, that protocols can be put in place to start reopening this economy, which I think is what the people want us to do, but they want us to do it very safely and carefully.
Is there a concern, and I think we've heard from some business owners, that there's a concern that once they are able to open, that they won't be able to get their hands on the necessary PPE?
Well, I think they should be trying to procure what they think is necessary. Not a lot of the businesses won't be open for some time. Some will be opening sooner. Certainly, that's what I do have confidence in is that businesses will make sure that their customers and their employees are safe. We're making sure that PPE is fully available to our healthcare providers, be it in long-term care facilities or hospitals or wherever. So we're making sure that is happening, but I'm sure employers will be doing the same thing. And we're doing everything we can to not rely just on global providers of the PPE. A lot of this was manufactured elsewhere. We're, as I said earlier, developing domestic manufacturing capability, not just in this province, but across Canada, to make sure that we have the supplies, not only for our healthcare sector, but for the private sector as they ramp up their businesses.
Are there any concerns? What if, once stores start opening and that dreaded second wave happens, are there concerns that it will quickly get out of control?
Well, I think we're concerned about everything all the time. So yes, that is a concern, and that's why part of our framework is to ensure that we're able to contact trace if there is an outbreak in a business, that we're able to provide the testing, the capacity if there's an outbreak, that we've got to see the community spread come down. And so that's part of the rationale that less people have COVID-19, the community spread. You hear from the chief medical officer every day about that. So I would say there's always concern. Nothing is risk-free. But I think we're doing it in a way that the people of Ontario want us to do it, and that is in a very methodical, safe, but a directionally positive way. And so that's why we're starting the process in various stages to start reopening the economy.
If you look at Durham's stats, the amount of community spread is, when you look at the new cases, there's still a lot of community spread out there. Do you think people still are taking the social and physical distancing seriously, or do you think people are getting so tired of being indoors that they're being a little not taking the steps that they should?
Well, I think the vast majority are taking it very seriously. The polling data and the stats I see is the vast majority of Ontarians are taking it seriously and practicing. Obviously, there's sometimes some people who don't, and you probably can drive around and see some of that in action. But that's why we keep saying you can't let go of the need to physically distance and practice washing your hands and so on and so forth. But at the same time, you can go out, you can go for a walk, just practice physical distancing. And I think that as the weather warms up, that'll happen naturally. So we're encouraging people, don't get complacent here. The community spread can ramp up really quickly again. So all the things the chief medical officer is saying, all the things you hear from the premier and the minister of health every single day, keep doing it because it's working. And we're seeing a little bit of light at the end of the tunnel. As I like to say, there's little green shoots developing. So let's keep going. Let's not get complacent, and we'll beat this thing.
Okay. Peter Bethlenfalvy, MPP for Pickering, Uxbridge, and the president of the Treasury Board of Ontario. Thank you so much for spending time with us today. All the best. Stay safe, my friend.
Same to you, Deborah, and thank you. And to all your viewers, be safe.
Okay. Until next time, I'm Deborah Hutchison. Thanks for watching.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
My mother said we had to leave home. The communists were going to take my father away. If my parents were afraid, they didn't show us. But we would never forget our escape from Vietnam. We were lost.
What was your job in Vietnam?
University professor.
We had no home.
Do you have any family in Canada?
No, sir.
Nobody wanted us.
Welcome to Canada.